This disorder affects 11% of U.S. school-aged children. 1 in 5 high school boys have it. 1 in 11 high school girls have it. They are talking about none other than ADHD on the Real Nurses Talk Show. Let's get started. So hi everybody, welcome to the Real Nurses Talk Show. Today we have a very powerful show for you. We're going to be talking about attention deficit and hyperactivity disorder, ADHD. According to a national survey on children's health, 1 of every 10 children in the US are diagnosed with ADHD. So the statistics are quite staggering, are they not?
They really are, and it's come up from years ago. We thought it was more like 3 to 7%, but as the studies have become more efficient and looking outside of the schools into the general population, we realize just how common it is.
Bridget Jordan-O'Boyle, you're a very well-respected nurse in this field.
I have been doing pediatric neurology as a nurse practitioner for over 10 years, and had a personal interest in kids with ADHD and other learning disabilities and behavioral problems, which is common in kids with seizures and some of the other ailments that I was treating. And then it became a little personal for me with my oldest son, and now this is my youngest son, Connor.
Hi, Connor. Thanks for being here.
Absolutely.
And so you were diagnosed with ADHD, correct?
Yes, I was.
Oh, wow. How long ago was that?
I don't remember when I was diagnosed with it.
First grade.
First grade?
Yep.
Yeah, that explains why I don't remember it.
So did you notice during that time that your behavior was different from other kids, or?
I did notice that I was a little bit more energetic, and I had a harder time focusing and staying focused than all the other kids. But, you know, I noticed that there were just other kids in general who, at the time, I knew that everyone didn't work the same way.
Right.
So I just thought that it was that.
It was just.
And there were other people in the class that just kind of had the same struggle, but it wasn't to that extent that I had.
Yeah. Oh, wow. It must have affected, like, sitting in class, listening, concentrating on the teachers, right?
Yes, it did. Because sitting in class is something. Sitting in general is not something I like to do it, but I just.
Well, we're glad you're sitting now.
Yes. It's kind of hard to sit still. So that always affected me in class.
Oh, wow.
So I usually tended to do what everyone else does because they want to get out of the seat, which is just tapping their leg and all that other stuff. So that's kind of what I just had to deal with. And
so what made you guys realize that there were some problems as you needed to do something more?
With Connor was pretty typical of the average student that ends up being diagnosed with ADHD, in that before he started school, we noticed he was a little ball of energy, and he talked a lot, and he had lots of traits like that. And as I said, my oldest son actually has ADHD, but compared to what my oldest son was like, Connor seemed pretty typical.
Got it.
So, but as soon as he hit that structure of the classroom and that side-by-side comparison to kids his same age, and the demands put on you by just normal schooling, it became pretty obvious at that point.
Oh my.
Kindergarten, the idea was never officially raised, but certainly the red flags were there.
Okay.
And within 4 weeks of first grade, his teacher was calling and saying, "Can we kind of talk and review his paperwork?"
Oh no. So that was affecting even homework and everything else. What about activities at home and socializing with other kids in the neighborhood?
Sure. It didn't affect me as much as some people would think it would. It was definitely a factor. It was there. Although it was with the kind of friends I have and had at that time as well, you know, it was just kind of those, they accepted me because we were so alike, so it was just kind of hard to even notice. the differences. So.
And even with the kind of diet we have now, especially high concentrations of sugar, kids tend to be very active. So I would assume it would make it really difficult to tell. It would have to be really extreme then, the behavior.
Any child can react to sugar in their diet.
Okay.
And some children don't.
Okay.
I tell the story all the time. My oldest child could eat sugar all day long and his behavior didn't change. But with Connor, I could tell when I picked him up from preschool whether grandma had given him a Pop-Tart in the morning because he was very sensitive to sugars.
Got it.
So some kids are and some kids aren't. And then when you have ADHD on top of it, it just makes it that much harder.
Oh, wow. So do you remember the kind of treatments? Did you have to go through like psychotherapy? Did you get drugs? What did they do for you? Do you remember, Connor?
I remember we started off with some pretty mild medications. It was just a few medications.
Did they help?
We kind of struggled with finding the right one. So some of them had certain side effects that either increased a certain area of it or sort of.
How do you mean?
They sort of increased an area of harder attention, harder focusing.
Interestingly enough, one of the medicines actually made it harder for him to focus.
Oh my.
And so, like many kids that have ADHD, it took a trial of 3 or 4 different medications to find the right one for him.
That would be difficult.
The nice thing is that these medications clear your system very quickly. So sometimes that's trying it for 1 week. Other times, another medication he was on for several months and worked great for several months and then just didn't seem to have the focus that he needed. And so that requires either a dose adjustment or a change in medicine.
That sounds really challenging.
It's really hard for parents. I do this every day. So to me, it's become very second nature. But having that unique experience of being a parent, I also understand that it's really hard to, parents often say they feel like their kids are guinea pigs.
Aww.
And to really reassure them that this is something that clears your system so quickly that we're just trying to match their brain chemistry because we don't want to change who they are. We want them to still be delightful young men and women and still have their own personalities, but to be able to be more successful and maintain their self-esteem too.
Right, and that's something I always tell people. What we do is medical practice. There's no cookie cutter treatment for everybody because people are so different.
Right.
Yeah, but it would be really challenging if you're going through that. Yeah. So how is it that you decided you were a family nurse practitioner? Pediatric nurse practitioner initially?
Trained as a primary nurse practitioner, but immediately we started working with the pediatric neurology group.
How come? Why neuro? That's what I was.
So I was actually a pediatric ICU nurse first, and neurology was not necessarily an area I was drawn to.
Right.
But through part of the nursing training, right, you do clinical rotations with a variety of different practices.
Absolutely.
And I joined a nurse practitioner who I respected greatly in her practice in pediatric neurology, and I really clicked with the people, the neurologists that I was training with, and really saw having that continuity of care it's still specialty, but following patients over the months and over the years and getting to know their families and know them better. And then the opportunity came up at graduation, so that's where I landed. And I was already starting to get the interest in ADHD, which again is at a higher rate in those
Sounds like you made the right
patients.
choice. You glow when you talk about it.
I get a little bit passionate, I'll admit it. It's like, oh yeah, don't get her started. I do. I've made a career out of it, so you have to have some passion.
Absolutely, I agree with you. So you practice locally then?
I do. I was with OHSU for several years, and now I'm in private practice at Sunstrom Clinical Services in Clackamas.
Yeah.
And I'm there with a team of psychologists, which really allows me to have a nice team, a holistic approach, which is the essence of nursing, is the whole person.
I noticed that on your website.
And focus on how families interact, and as you mentioned, how is this impacting him with his friends? That's equally important, sometimes more important than the grades.
Or even holding jobs. Are you at the age? You're not at the age where you can get a job yet, huh?
No, only around the house.
It's good enough for now.
So you've had a lot of training in ADHD and a lot of education, obviously. And I noticed I also did some training on Tourette's too. Do you do both? Is there similarities between? I mean, why the two?
So Tourette's is a chronic tic disorder. However, more than half of the kids who have Tourette's actually have ADHD.
Got
And
it.
more than half of them have an anxiety disorder, usually OCD.
Okay.
And anxiety is a common comorbidity or common coexisting disorder along with
Got
ADHD. So there
Got
starts
it.
to be a lot of overlap.
Got
The other part is the main part of ADHD medical treatment are the stimulant medications, which notoriously have increased tics. So if you have somebody who has a tic
No.
disorder
Right.
and needs their ADHD treated, how do you manage that?
Right. How do you?
You still use the stimulants.
No way.
It's first of all, it's about prioritizing. Some
Got it.
kids have tics or twitches,
Mm-hmm.
and they don't bother them or anybody else.
Mm-hmm.
So it's really the focus of their grades or their behaviors that are the problem.
Got it.
Most kids do fine with the stimulants even if they have tic disorders. But some kids, the tics actually decrease because their stress goes down. They're not getting in trouble as much. They're doing better in school, so
Oh,
they were more
wonderful.
relaxed, and their tics actually improve.
So that reminded me. You mentioned that some kids get on medication. Did you get anything like that?
I actually have, and it's kind of like it's almost like a shiver, except it's to a little bit more of an extent.
Like you're not cold, but you just
Yeah,
shiver every
exactly.
so often. Okay.
And at first, when it first started, it was me ended up bouncing a few inches off the couch.
His tics got pretty
Oh my
severe.
goodness.
And a throat clearing.
Yeah, and throat clearing as well. But both of those have
That's
gone
interesting.
down quite
So
a lot.
throat clearing would be a tic.
It can be. In fact, 1 in 4 kids will have a tic in childhood regardless. That's just normal numbers.
Got it.
Most of us just blow it off as a bad allergy season.
Got it.
You know, Johnny sniffed for 3 months last year, but he didn't have any other allergy symptoms. Guess what? The sniff was probably a
It's
tick.
yeah. Interesting. So, can you explain to our viewers then what exactly is ADHD?
So ADHD is a developmental disorder, meaning that it's part of the normal brain maturation, if you will. And with these kids, the development of the brain in certain portions of the brain is about a third behind their age peers. And most of the things that we look at are the frontal lobe, the prefrontal cortex in terms of executive functioning. There's a lot of big words there.
Right.
But what I like to say is if you think about the kinds of skills you need as an executive assistant or the executive of a business, much like yourself, to be able to plan and
wow.
organize, to know where you need to be, where your briefcase is, to be able to control your emotions in the moment, let other people talk first.
Right.
So if you think about those higher functioning skills, those are the ones that the kids are behind. And it's just behind. It's not that they won't come, they're just later. So
Okay.
sometimes a 9-year-old may act more like a 6-year-old in being able to control his emotions.
Got it. So with the right treatment, they can catch up.
They improve
They
for
improve.
sure.
Okay.
And over time, your brain continues to grow and mature.
Got
There have
it.
actually been brain MRI studies that have shown the changes in the brain, and the structure of the brain seems to catch up around age 15.
Got it.
And we all know that most adults aren't really adults until about 25, and that's all part of that same maturation process.
Got it. So, I mean, I've heard the term ADD, ADHD. I mean, so is this a new disorder that we're recently, discovering, or what's going on with this?
It very much is not.
Okay.
What has changed has been our knowledge, our awareness, and the demands on our children, frankly. ADHD now encompasses both the inattentive, hyperimpulsive, and combined types, where in the past we separated out the ADD from the ADHD, meaning hyper and not hyper.
ADD, hyperactive, and
Right, so attention
compulsive.
deficit, and there was attention deficit disorder where kids were not really hyper, they were just maybe chatty Cathy in the
Got it.
classrooms or had trouble with focus. And then the hyperactivity disorder piece of it
Right.
was felt to be separate. Now we call them all one. We
got
call it ADHD, predominantly inattentive, predominantly hyper.
I also noticed, just from being in ICU, I don't take care of pediatric patients because I'm in adult ICU, but I noticed that I have patients that come in with newly diagnosed ADHD, I mean, and they're older than 50, sometimes even older than 60. Why is that?
One of the things that we thought about ADHD was that you would just outgrow it. And what we're finding is that we don't believe that they're outgrowing it, just changes over time, just like we do.
Okay.
And for some people, your brain matures enough and you learn enough other strategies and you get to pick what you do for a career that fits your personality better.
Okay.
And so we just went on and did what we do. But I think now with our modern culture and the pressure of everyone needs a college degree or everyone has to function at this higher level, that we're being challenged more. And people are making that decision to get checked out and to see if it's still bothering them and if they want to use medication to continue in a particular career path. Or some families, the ADHD affects them within their family as well. You can think of as a parent, all of the responsibilities that you have.
Right.
And if you can't remember who you're supposed to pick up when.
Ouch. Yeah, that would be problematic. Yeah. So I was just thinking about this. I know we didn't mention this before when we were talking about the show. So if it's something you can answer, it's perfectly okay. But I was just wondering, are there learning disabilities then associated with it? Because
yes, there's a higher rate of learning disability as well with ADHD. Writing is particularly hard for kids with ADHD, whether it's a learning disability or not. If you think about
is it because they have to slow down and focus?
If you think about the demands, right? We have a thought, it just comes right out your mouth impulsively, and then you're good to go, right?
It's very true.
But if I have to try and control all the muscles down to my hand, and then worry about punctuation and spacing and handwriting and grammar, it becomes much more difficult.
That's a great way to put it.
And it also gets more difficult because having that focus problem, it's harder for us to remember what we have it up in our brain.
Right.
But for me especially, it's hard to get it from my brain down to my hands onto the paper.
Oh my goodness.
So that's also a part, and just the focus in general with normal people will hear just major sounds, but with ADHD we notice all the little things. Like, for example, if someone's adjusting in their chair, we'll notice that. And if someone is erasing, other people will just blow it off, as opposed to me, especially with ADHD. That's all we can hear. We hear all the minor things, and it's just really hard for us to focus on one thing.
One of the reasons I actually am not a fan of the name ADHD, I know I'll never get rid of it, but it's not an issue of attention deficit. It's that they pay attention to too many things and have trouble filtering out what's important.
It's a focus deficit, but not an attention deficit.
Right.
Yeah.
Good point.
Yeah, that's a very good point. So what is, given that, remember we talked about the age for diagnosis.
Right.
So is there a recommended time when symptoms are usually seen?
Right. Oftentimes, parents will start to seek out help from their pediatrician, which is where you should go if you're having concerns, or from the school about attention and focus, and sometimes it's as early as kindergarten and first grade. Under the official diagnostic criteria that we use, it used to be that symptoms had been present before 7, but that doesn't mean that they had been assessed before 7, but that in retrospect we remember these were problems, or these were comments that were on the report card as early as kindergarten, and that was adequate. The recent DSM-5, which is our diagnostic Bible, if you will, moved that age up to 12. And I think that was a large part to help capture some of the more inattentive issues. The kid who's having trouble sitting in his chair, wiggling around, making noise, tapping his pencil on the table is much more noticeable than the kid who's merely just staring off into space but manages to get their work done. And it's not until the challenges of the upper grades that starts to play a role.
Yeah, and for me especially, a part of the ADHD is I tend to zone out a lot, and so that's just kind of a part of the focus.
Was that before or after treatment?
It's just something that's been there. It's just always been like that. It's gotten better, but it still happens on occasions.
And I should follow up, one of the questions you asked was whether he'd received psychotherapy or those sorts of things. There is behavioral therapy, behavior modification therapy, that is usually given by counselors, therapists, psychologists, or other folks that have been adequately educated in that, that really should go hand in hand with medical treatment. They overall better satisfaction and less medicine are needed.
Right.
For some kids, it delays the need for medication at all.
Oh, that's wonderful. Yeah. So since we're talking about what it is, we might as well go into discussing how you diagnose it.
Right.
Yeah.
So ADHD has 18 specific symptoms. 18. And you have to have at least 6 out of 9 of the inattentive or 6 out of 9 of the hyperimpulsive that are impacting your life in order to meet the diagnosis for criteria.
6 out of 18.
So the most common ones most people can think of, we talked about difficulty staying focused, staying on task, distractibility, forgetfulness, organization, impulsive, interrupting other people when they talk, intruding in on other people's conversations, running off in the store when they shouldn't be.
I do that sometimes, like I'm doing right
that's
now.
a perfect example, right? It is a matter of how extreme those symptoms are,
Got it.
how many you have, and if it's causing a problem. There are kids who act like that unless they know that they need to behave, and then they can pull it together to behave. That's not ADHD.
It's a lack of impulse control.
Right. Right.
Okay.
Yeah, and on top of all of that, it's also a part of how often they occur.
Okay.
That's also another part of it. If it's just on occasions and it's just a kid being a kid,
Right.
running off because he sees ice cream.
Right.
But if he does it every time, and it's not just ice cream,
It's like everything.
then it's everything. Then that's a factor of it.
Oh, cool. Cool. So 18 different, that's a lot.
Right.
So what causes this? What causes ADHD? Do we have any idea?
80% of it is
Just the brain.
genetics.
Genetics.
And
And that's why it's a neurobehavioral problem.
Right, and
Got
we've
it.
understand now that it really is a role of neurotransmitters, dopamine and norepinephrine being the 2 main chemicals in the brain that are involved with ADHD, and that's where the medications work, is on that level.
So can you tell people what dopamine and norepinephrine would do to their body?
In this case, these are the chemicals that carry the message from one brain cell to another and keep it going straight and narrow on a specific path, if you will. I like to tell people, if you need enough dopamine to open the door on the next brain cell for that message to get through, to be wait, stop, think what you're doing.
Right.
For some parents, I'll liken it to the old doors with 4 or 5 locks on the door, and you have 4 or 5 keys to fit those locks. And you have to have all of those keys turned to the right position all at the same time in order to open the door. But if I put some of those keys back in my pocket before I'm done, then I don't get through the door.
Right.
And that's what happens with dopamine, is that it gets recycled, it gets put away before it actually has let that signal move on. And so the medications, the stimulants specifically, keep the keys out of your pocket. They keep the dopamine available longer in order for those messages to get through.
That's a great analogy. Thank you. Yeah. So signs and symptoms we discussed already. Is there anything else you wanted to add to those?
One of the hardest things for kids is some of them don't even recognize that they have the issue.
Okay.
Okay.
I know, I barely noticed it.
You were just being you, right?
Exactly. It's just a part of who I am.
Right.
They often miss those social cues. Part of one of the criteria is rushes through their work and make careless mistakes. And I think that impacts them socially as well. They just don't see the faces people are making or understand the way they're impacting other people. And so they just keep going. And so they can kind of burn through friends pretty quickly when that's the case.
Unfortunately, that's
It can happen.
and it's not just with people who have ADHD. It's a little bit more than just average people that don't have it, and it's just more than just a part of life.
Right.
It just kind of adds on to how many.
And makes it pretty social situations pretty stressful.
It can be. It can be, especially the emotional control, because part of that is being inhibited, being able to control yourself and control your reactions to people. So if someone says something to me at work or at the playground and it offends me, if I'm well enough inhibited, I can say, let me think about that before I react to it. Maybe there's some truth, maybe there's some not.
Right.
Where somebody who's a little more impulsive,
This
is how we end up with playground issues and arguments, and because I react first before I think about it.
Think.
Yeah, and that's just you know, that's just a part of what happens. And in general, even without ADHD, it can just kind of come out.
So did you get into a lot of trouble in the playground, detention,
no.
stuff like that?
No, not really. I just...
We've had our share of principal visits.
Yes, I have. Then again, that's just
Mommy
part
would
of
know.
Of course,
Yeah.
she's a mom.
Right.
But it's just something that it will affect you a little bit more than other kids would. So
That's hard.
Yeah.
Yeah, you're a very smart boy. Yeah.
thank you.
Thank you. And
blows
he's
my
very
mind sometimes.
knowledgeable about your disorder. That's pretty.
Well, yeah, when you have mom that works it and raises it both, it tends to be a topic of conversation.
It does.
Yeah.
So the other thing I was going to ask too, I know you commented that it is a disorder, not a disease. So I think of disease as something that is causing some kind of disease, discomfort in the body.
Right.
But generally, why would we prefer disorder over the word disease?
It's a great question. Disease, though, is generally something that's foreign to us. It's something that happens to us. We catch a cold.
Right.
And although nobody thinks, I think, anymore that ADHD is catching, that's not the issue.
Right.
But again, with disorder, it's impacting a variety of parts of your body. A disease may infect your liver, or it might infect your lungs, where this is more pervasive throughout the body. And again, it's developmental in that respect.
Got it.
Yeah.
So speaking of developmental, that's kind of like a segue that giving us the time.
Yeah.
That's kind of like a segue to my next question, which is autism. Is there a correlation between that?
There is. It's funny because some of the behaviors exist in both disorders.
Okay.
Those with autism often have executive functioning problems as well, attention, focus. Sometimes the distractions come from a different place. They may have more sensory distractions than the typical ADHD student does. And you can have both at the same time. Okay, so they're not mutually exclusive. Autism, though, is much more impairment in terms of communication and social skills than even the ADHD.
Right. So, are there any research that are noteworthy to mention in this field?
Well, interestingly enough, ADHD was once labeled the most researched childhood disorder ever. Okay, so there's lots of it that's going on. There's a multi-treatment modal that we don't really have time to go into, but it was the first multi-site study that looked at medications versus behavioral intervention. So MTA study is something to look up if somebody's interested. But we're learning so much more about how this impacts development, coordination, balance, and those sorts of things, visual motor integration, that I'm fascinated by what's coming out.
Oh, fun. Yeah. So we're about to wrap up. I just have one last question for you. What advice would you give to parents out there who have children with ADHD or child with ADHD?
I make sure that at every visit that parents know that bad parenting does not cause ADHD. Okay.
That's important.
As a parent, sometimes you do things you may not be proud of or that you wouldn't necessarily want to do again. But it's not the cause of your child's problems. If you have questions, just talk to your pediatrician. That's your first stop.
Oh, thank you so much for being here. It is time. Thank you all. My name is Sonia Justice. Leonard guest has been Bridget O'Boyle, right?
O'Boyle.
And Connor, his son. And this has been the Real Nurses Talk Show. Until next time, bye-bye.
Thanks.
Bye, guys.